Hi, everyone. Welcome to lecture. We're going to talk in this part about healthcare, and we're going to talk a little bit about some general industry overview information, and then we're going to look at some specific occupations or professions within the healthcare industry. So, first, just take a look at this very healthy or rich definition of healthcare. It is the diagnosis, treatment, and prevention of things that happen to humans, such as injuries, diseases, and impairments. So it is a very rich definition in terms that it encompasses all of the things that we would do to rehabilitate, prevent, or habituate a person to be their healthiest. So healthcare happens in a process flow. The way that healthcare works is that you usually have a primary care physician, and that's referred to as primary care. So doctors and nurses are typically the first point of contact for patients, and that is your primary care physician, your first contact. Some of these primary care physicians are family medicine specialists, some are internal medicine, and some specialize in pediatric medicine. But the point is that doctors and nurses that patients see first are the primary healthcare flow. They may refer you to see a specialist, someone who specializes in that impairment or disease that someone's suffering from. And that person might be someone like a cardiologist or an oncologist, and that specialist might treat you from there at the secondary or tertiary care level. Oftentimes, too, your primary care physician or even that medical specialist might refer you or order you to see some type of allied health professional. And there are so many types of allied professionals, I thought I would show you this little clip.
There are many allied health professions. So if you're a prosthetist or orthotist, a paramedic, a physiotherapist, a podiatrist, a speech and language therapist, a diagnostic or therapeutic radiographer, an art, music or drama therapist, a dietitian, an operating department practitioner, an occupational therapist, or an orthoptist.
So you kind of get the concept there. Didn't want to rattle all of those off, and I wouldn't make you commit them to memory. But the point is that the allied healthcare professional is not the first person that the patient sees. If someone has lower back pain, they don't walk into a physical therapy office. Well, I guess I retract on that. We're going to talk in just a second about healthcare financing. And I guess if a person's paying out of pocket, they could theoretically do that. But in most cases, patients are referred or ordered to see a physical therapist or an occupational therapist. And so that happens in that tertiary or secondary level, not that first contact that the patient experiences. So that's just a little bit of an understanding about the way that healthcare flows, because this is kind of helps you situate, where you want to be in that process. Do you want to be the patient's first line of contact, like in the emergency room, doctors and nurses, or do you want to be when it's a little bit less urgent, perhaps? So there's also different settings where healthcare takes place. Now, all of these are clinical in nature, but the term clinic actually has kind of a distinction. So looking just a little couple differences, you could probably make a huge list comparing hospitals versus clinics, but I just picked out a couple key attributes that stood out to me when I was learning in ways that were easy to me remember the differences. So first of all, the speed of care. The speed of care and the urgency of care kind of go together, but when you're ever talking about a clinic, the speed of care is like long term. Usually it's outpatient, so a patient is visiting there. They're visiting there over a period of time, and the goals for treatment are just that. They're longitudinal. They're very long term. This is sometimes called ambulatory care. It's just not critical. Now, when we're looking at hospitals, typically the speed of care is more acute. So it's for some kind of acute injury or some kind of acute trauma, but it just happened. A person is in this setting immediately, and usually there's a sense of critical urgency in the care. Now, that when it comes to the whole immersing yourself in the treatment, that's another way that we can distinguish hospitals from clinics. In hospital settings, the intensity of the treatment is intense. So you're going to stay there, right? You're going to stay there. You're going to immerse yourself 100% in your care. You're going to spend the night. You're going to do everything you can to get better. In an outpatient setting, again, there are no beds. The patient isn't immersing themselves in treatment. They're back to doing their normal daily activities. And this treatment is just a longitudinal, ambulatory continuation of something that may have happened more acutely. The best way to remember these, and what I always tell students who are seeking observation hours and they want to know what the difference is between inpatient and outpatient, I always just tell them that if there is beds there, if people sleep there, then it is inpatient, because the treatment of the intensity of the treatment is there. If it's an outpatient facility, there are no beds and people don't spend the night. Okay, that's a good way to remember the difference between inpatient and outpatient hours because typically both will be required. Also, there are skilled nursing facilities, and these are to be distinguished from nursing homes. So, nursing homes are typically, they look very similar, but skilled nursing facilities have licensed professionals running them. So, you'll have actual RNs, actual PTs, actual doctors. A nursing home may just be somewhere kind of like a nursery for children. It could just be a care facility. It could be for entertainment purposes for elderly folks. It could be for a number of just hygiene, home shopping. So skilled nursing facilities are medical facilities with licensed practitioners. One little tip is skilled nursing facilities are really nice to acquire inpatient hours. Students don't usually think of that. They think of going to hospitals to acquire those. Home health is another incredibly booming area, and we'll talk more about that when we look at areas of trends in healthcare. But home health is another setting, and this is a really, really, again, huge growing area. All the devices and equipment to support home healthcare has really taken off, and especially in the last year with all of us, being relegated to being at home. So there are several different types of hospitals. And I also could have put this up here by different department types. I mean, I didn't want to get too out of control with talking about hospitals because I know, not all of you are super into the hospital concept. So lightly on hospitals, they're typically classified as either acute or long-term care. Most of the time they're acute. So about 90% of hospitals are acute care, meaning that you go there for a trauma or acute situation and then you leave. They're also classified whether they're private or public. So for instance, a private hospital will have stockholders and it will have its own organizational structure. And it's, opposite of a public company, which does not have a profit agenda. It's not for profit. So it might be ran by the federal government. It might be ran by a state government, but it's not owned by shareholders. It's not a public or a private entity. There are also teaching and non-teaching hospitals. So teaching hospitals, for instance, Rady's Children. Rady's Children, if you go there, in fact, this is our care facility for our kids. It's where our medical group, contracts with. We go to Rady's Children, and I love the element of it being a teaching hospital because you don't just have one doctor. Even your primary care physician rotates between a team of medical interns, recent grads, people doing residencies. And so it's a really, really rich place for smart minds to be thinking about your particular case. So I love research hospitals. Some people don't. Some people think of them more like massage schools or, haircut schools. I love them personally because I think that young learning minds, and not even young necessarily, but learning minds are where it's at. So teaching and non-teaching hospital facilities. There are also federal and state facilities. For instance, like we just talked about, or I don't think I brought it up yet, but like the VA. We actually have a really great VA here in San Diego, and that's a federal hospital. And we'll talk a little bit more for specific occupations. Federal hospitals actually pay really good. And that's kind of contrary to what we usually think when I think of like postal workers and other federal employed workers. I don't think of usually big bucks. San Diego hospitals. So this is just to help you out in your quest. I would never make you memorize these, but there's, anywhere from 15 to 20 big hospitals here in San Diego. Again, I mentioned the Rady's Children, there's the VA, and then Scripps and Sharp have a number of facilities. So there's lots of different Sharp facilities, and they're just subclassified based on location. And then same with Scripps. And depending on, which insurance provider you have will dictate which of these different medical facilities that you receive treatment. And we'll talk more about that in just a moment. And again, I'm not fully educating you on hospitals and all of those things. We're just touching on where we're going next, which is healthcare financing. So how is healthcare paid for? This is a big topic when it comes to healthcare because healthcare is not free. In fact, we know it's wildly expensive. So how do we protect Americans and everyone in the world, but I will say Americans because everyone has their own unique way of doing this. But here in the US, to provide people healthcare coverage, it has been a storm. I wanted to say an S show, if you know that euphemism, but it's been an S show because we just can't figure out how we're going to provide people the healthcare coverage that they deserve, but yet maintain the integrity of, the taxpayer dollars and education and all the other goals that we have with our public money. So healthcare financing is an interesting topic that you as a student should pay attention to. And reason being is because the ethical issues and your core values about these issues are going to be perhaps part of a review when you apply to a graduate school program or a professional program like physical therapy or athletic training or a dietetic internship, they might ask you questions that relate to your knowledge about this topic because it's important. And if you're in the field and in the industry of healthcare, you have to understand where the money comes from to pay for your services, because you know that the people that you're treating aren't paying for it. So it's kind of an important topic, and not saying that you're going to be reviewed based on your opinion about it, based on your knowledge of the way that it works. And so these are things that in classes and in observation you should just be mindful of. So essentially with healthcare financing, there's two kinds of healthcare financing that are publicly or government funded. These are referred to as Medicare and Medicaid. The main difference between these, there's a bunch of key differences in like what's provided, and I'd love you to learn more about it. This is a great video if you really want to know more about the differences. The level that I would want you to understand is that essentially Medicaid is a much bigger program. It is for lower income individuals, and in California it's called Medi-Cal. So it covers everyone. It's just based on income. Medicare is for older folks. And so obviously with the baby booming population, it's been more popular and more popularized. I know I've heard a lot more about it because the aging population and the growth and expansion of Medicare, which is another way that healthcare is covered. Now, another thing that you might be familiar with but not well versed is the concept of healthcare reform, or when President Obama was in the House, it was called Obamacare. And probably the real name on this was the Affordable Care Act, but we know it in a million ways. Healthcare reform, Obamacare, Affordable Care Act. Essentially, it's all the same thing. It's to provide people more coverage, a bigger umbrella, making sure that we provide everyone with healthcare. And essentially the idea behind this was that we would make employers who were already providing healthcare provide more. We were going to make people who didn't have insurance through their health or employer buy it on their own. And this was kind of a cool concept in that if everyone had to have it, then it would create a market where it would drive down the price of insurance. And this would have, lots of ripple effects that are beyond the scope of what we're learning. But essentially, if you could create a market for individuals to buy insurance, it wouldn't be such a monopoly for big employers and corporate gurus and so expensive. So the concept was neat to provide more coverage, both through government, both through employers, and through people buying their own insurance. Now, whether it's working or not, it's a big controversy because we had a different presidency come in. There was lots of different legislative votes and changes. Right now, I think the concept is still the same, is that we would like to have people in the US have more healthcare coverage. Now, if you know anybody in the field or working in healthcare, ask them how they feel about it. It's a good question to ask because they might give you the side of what a practitioner thinks, which is, well, I used to see 7 patients a day and now I see 14 because everyone has healthcare. Or they might say something like, I think it's wonderful our clinic has been able to expand. I mean, it just depends on where they're positioned, but it's a good question to ask. Your understanding of it is pretty essential. Now, insurance is also funded privately, which means that it's paid for by your employer, which I just brought up a second ago with the Affordable Care Act. The government was saying, hey, employers, you have to provide your insurance more coverage, right? So employers pay for it. It's also paid for privately out of pocket by people. And they also, in the Affordable Care Act, wanted this to increase. Everybody has to have it. If you don't have it, you're going to get a penalty. So everybody has to have insurance. There's also people that have a combo. I know that before I was hired at San Diego State, I had a combo package where I worked at a restaurant that had a tiny little package, and then I also paid for healthcare out of my own pocket. Now, insurance provider plans come usually in these two forms, the PPO and the HMO, a preferred provider and a health maintenance organization. Now, I personally, and I think most people at state, unless they pay more, have an HMO. So a provider that provides an HMO, for instance, mine is Blue Cross. There are tons of providers. And again, this isn't a whole big lesson on insurance because it is complicated, but I'm trying to slowly unfold the tangle. So a person is employed, they're provided insurance, either by themselves, they bought it, or they got it from their employer, or maybe a combo. The provider of that insurance, the person that they pay every month for the bill, is a big company. And that provider, you may not recognize much much. Some we do, like Kaiser, because there's also institutions that treat that are also called Kaiser. But like, for instance, Blue Cross, which is my insurance provider at San Diego State, and they contract with a medical group. And that medical group includes primary care physicians, acute care facilities like emergency rooms, and specialists. Like if I have a problem, I can go see a specialist at Sharp Community Medical Group. So it gets confusing though, because if someone says, who's your insurance provider? You're like, Sharp. And they're like, what? I'm like, oh, my bad, it's Blue Cross. But Sharp is my medical group. That's where my physicians are. That's where my treatment providers live. And that's a group that they have contracted with my provider. So again, just a little introduction to get you thinking about how confusing the topic is so that you make sure that you're ready for it. Some of the trends in healthcare are driven by the last year of healthcare being thrown upside down and tossed inside out. And everyone, what they've gone through is now brainstorming to come back and look at some ways that we can improve operations, business, and the culture within the healthcare industry. So number one, obviously, we've seen a humongous change in the delivery of healthcare. So virtual or telehealth, whatever you want to call it, is up obviously a lot from 1% last year all the way to 43% in 2021. So telehealth and doing all sorts of, especially with your primary care physician, that primary care is probably a much higher percentage because almost all initial consults and things that don't need physical treatment are being done virtually. And for a good reason, and we've learned a lot of positive things out of that. We also see changes with artificial intelligence, and this has been here for years. So every year I update what's going on in healthcare, and I've always seen big data, collecting data so that we could look at trying to systemize and basically digitize some of the ways that we do healthcare, daily healthcare processes, and especially with record keeping and all of those analytic things. So this has been coming, but now it's been a really big deal because of our virtual care, because of everything being documented, recorded, and tracked. We have much, much more big data to work with in terms of what we know about patients, their health outcomes, and so we'll be able to generate better AI from that. We also know that with operations, people in healthcare administration are focused on making sure that there's a much more agile supply chain. So if, God forbid, what is plan B? What is plan C? In case we need more ventilators, more masks, more gloves, more everything. And so we really figured out that we need more agile backup plans for supplies in these big institutions. Industry stuff, some of the different trends that are going on in the healthcare industry. One includes the support occupation sector. So we didn't talk too much about the industry in terms of the way that the government classifies these little occupations within it, but within healthcare and within allied health professionals, like physical therapists, occupationalists, dietitians, they have support occupations. So a physical therapist aide, or a nurse's aide, or a diet tech. So these are people that support the occupations that are the allied health professionals. And this has boomed. And again, it's related to the virtual telecare. It's related to the home health growth, which is another area that's boomed tremendously. People having individual providers, usually contracted through some kind of contract management company. They have these individual providers coming in and treating them in their homes, which again are done usually by support technicians instead of the actual licensed professional. So huge boom in this area. And I know you guys are in a bachelor's degree program, so you're probably not interested in high school degree level and associate's degree level certifications and professions and careers, but you should be aware of the growth in these areas because it's the field you're entering in. It's the people that you'll know, the networking that you'll do, and the growth in this area is tremendous. Same with home health. Business. Oh, and on the last topic of home health, because I will only talk about this again when we specifically look at dietetics, but home health sector is growing, but really where to look for jobs in this area are contract management companies. And I mentioned that a second ago, but contract management companies are like unaffiliated with something you'd recognize like Sharp or Kaiser. They might be called like Aramark or Sodexo. You would never, recognize the names of these companies, but they employ dietitians, occupational therapists, etc. And the home health contract management companies have boomed. So for traveling dietitians, and they pay really good money, sometimes more than just big hospitals. So again, it's just kind of good for you to know these industry trends. There are also trends from a business perspective. And this one's fun to explain because this one I read as called Coopetition, but I didn't want to like steal that because I don't really honestly know the rules with putting these kind of videos up. But it was called the Coopetition is the biggest trend in hospital right now because they're seeing that places like Walmart and places like CVS and Walgreens, the little minute clinics, I mean, they are cranking out healthcare that was really difficult for clinics and offices to keep up with: screenings, shots, vaccinations. These are the things that would weigh down the profits, the core profits of clinics that were specialized to do other things. And so it's just been kind of nice to see partnerships, and I think they viewed them as competition essentially first. And now I think that they're going, hey, wait a minute, this could really benefit us, alleviate us from some of these more, cumbersome, low profit generating services. So then lastly, I know this has been a long slide, sorry. The last trend in healthcare is, related again to what we've seen in the last year. It's important that everybody in every crevice and crack everywhere is open to the concept of inclusion and diversification so that we have every pocket in every place looking exactly the same. And, not to say that having different uniquenesses isn't great, but the uniquenesses have to be spread and dispersed among organizations. And we are finding that inclusion is it's been amazing to watch. Like, our department has been on an inclusion mission for a decade, and looking at the change in the faculty, it really just rolls right down into the success of the students because the faculty look like them, and people just, frankly, we know in research, they identify with who they look like. So it's been neat to see the changes over the last decade, and I think hospitals are following the same trends, is that inclusion in hiring, inclusion in the way that they set up their organizational structures. And then obviously, I guess I can't go without saying safety, because we all know that safety protocols have been probably all that anyone in higher administration and higher corporate levels have done for a year straight. How can we make it safe, and how can we let the community know that it's safe to come back? So safety, inclusion, and diversity are the biggest cultural changes that we're seeing in healthcare in this next couple coming years. Who works in healthcare, or who tends to have a successful, thriving life in healthcare? Well, I personally think, and there's a lot of research out there on this, I certainly didn't come up with this. I mean, there's articles that talk about specifically this, that you have to be empathetic and emotionally stable to work in healthcare. There's also research, and I can show you guys articles that say that the two traits that are related most to success in a career in healthcare is a sense of drivenness and conscientiousness. So there are research found associations between people's traits and how successful they are in healthcare. But personally, my favorite, back to that, is I love the empathetic one. I have a sweet little video on this I'm going to show you guys.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no. You want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with "at least." And we do it all the time, because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now. I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
Okay, let me wipe the tears out of my eyes. Isn't that the cutest thing? But it really is at the core of how you could possibly treat someone who is suffering, and just, let them know that you understand, and not that it's just your job, right? It's got to be hard to do after a while. People that work in healthcare are obviously physically fit. There isn't much sitting down for healthcare personnel, especially those in the primary and secondary and tertiary part of the healthcare flow process. So, there are physically fit. I wouldn't necessarily put a specific quantification of it, but I've looked through a million job announcements for these types of physicians, and they always say things like can stand, can bend, can lift 20 pounds, can move patients, etc. So physically fit is always going to be one of those abilities that are listed as required. Skills for healthcare personnel. You're never going to find a healthcare personnel or profession or occupation that doesn't list communication skills. So not only interpersonal communication skills, but verbal communication skills, written communication skills, all the sorts of communication skills, because you have to be able to listen, you have to be able to digest, you have to be able to, again, express empathy, you have to be able to communicate with not only people that may not even speak your language, but also people that are 5 degrees ahead of you in this particular area. So you have to go a long way in your communication skills in healthcare. So that's all I have for this piece. General overview on healthcare, a little bit about how it's financed, some of the trends, and some of the different features and traits that are likely to lend to the success in the field. Thanks for listening.